Trigger warning. This episode today will contain topics related to suicide and suicidality. So, for those of you who find this is a sensitive topic or is a topic that is triggering, please be aware that this is the subject matter for this content today. I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So, what are you waiting for? Let's do the damn thing. Hi, and welcome to the Greeners Podcast, an unfiltered discussion related to health and healthcare at the intersection of politics. My name is Amie Archibald-Varley, and I am the Gritty Nurse. So today, we're actually going to be talking about something that's really topical. The entire month of September is Suicide Awareness Month. So it's really important that we have these conversations. And I know that a lot of people want to shy away from this conversation. I know that even like there's shadow bans like on the internet. So for example, if you're on Instagram or, TikTok or any of the other social platforms, if you actually type in the word suicide, that it kind of shadow bans your posts, which is really messed up. Like I understand that obviously it's important to ensure that, if there's content out there where, and I know it has happened in the past where someone live streams dying by suicide, that they really try to protect obviously the public and people who have access to seeing that type of video. But I think a complete shadow ban on the conversation itself, because there's other parts of the conversation where some people say, hey, if you talk about it, it's more likely to be seen in society. And we've seen that there's a lot of evidence that suggests that that's not the case. But it's again one of those things that we need to talk about and that we don't talk about enough. There's so much stigma related to mental health, and particularly talking about suicidality, where it's not discussed whatsoever. So I think that's like a big part of the problem. So like I said, I really wanted to start with even just a quote. So the quote is, "There is hope even when your brain tells you that there isn't." And I know that for a lot of people, that's like the biggest challenge and the biggest struggle, right? Where you feel that there is no hope because your brain is telling you that. But again, it's because of that chemical imbalance and needing that additional support when you don't feel that you're having it. And just having, medication is a huge thing in terms of making sure that you're feeling regulated, and as well as talk therapy. But it's one of the things that I have to even remind myself of as well. So, as a healthcare provider, I think one of the biggest things is we talk about codes, right? So, code blue is something that's very loud. And when we call a code blue in the hospital, all hands are on deck. Everyone's there running, racing. We have all the equipment that we need. Go get the crash cart, go get this, go get that. And when it comes to, whether it's we're talking about mental health, this is a silent code. There's no conversation about, there's no code for this type of crisis, right? I think that speaks again volumes to the fact that we don't even have a specific crisis code for something like this that might be happening. But again, it's the awareness that we all need to have, and we all need to be able to spring into action. Just like if it was like any other code that we just spring into action, like we would for a code blue, we should have the same materials. We should have the same things on deck or in hand. We should have our code blue cart or our, silent code cart. We should have all hands on deck approach. We should have all personnel available and ready. We should have we should have all those things, more specific language and more framing around having this conversation. So that's what I'll be talking about today, really unpacking suicide awareness within healthcare and talking about the silent code that shouldn't be silent, that we should be ringing the alarm bell on, and that we should be talking about not just in September, but for many months to come. So it's not very often that I go back and I talk about a place where I was 5 years ago, but I think it's probably quite topical as we are talking about suicide and Suicide Awareness Month. So as you know, one of the reasons that the Greeners was started, and actually was the impetus for starting the Greeners, actually came out of a mental health episode that I had myself. I was working in an organization where I just started as a new leader. And again, I think these are these instances where you think everything's going well, you're super keen, you're excited, and things just don't go the way that you expect them to go. And again, I think this is why, and I would say in this particular moment, I think, for people who might have not heard the story before, I started to be gaslit. There were those times where I would say, where I would be saying to this leader or this person that was my boss at the time that, hey, what you're saying doesn't make sense. We exchanged emails. You said this thing, and now you're saying this, to the point of harassment in terms of harassing me on the job, the way that she would talk to me and the way that she would address me in front of our other colleagues, and how she would talk me down and dress me down in front of other people. And it was pervasive. I think people think that this is something that has to go over a period of years. I mean, this really probably transpired over a period of about a year, where all of the stuff really started to kind of take place. And it really took a toll on my mental health. Previously, I already had issues related to anxiety and depression in nursing school. And I think I talked about being in nursing school and having my very first panic attack. And that kind of what put me on to knowing that, some things are different, and knowing that I was different, because again, in our family life, and maybe even within our culture, we didn't really talk about mental health like that. We didn't talk about, someone needing support or someone having a panic attack or what that might have looked like. So kind of fast forward back to my workplace, where I was talking about, being gaslit and harassed, being spoken down to. I actually remember confronting this individual, and my mental health was like really bad at this point. And I confronted her, and I was like, hey, how you're responding to me in all of these instances. And again, of course, this was a nursing leader. I'd be like, the way that you're talking to me, the way that you're addressing me, you don't talk to other staff members like that. I was, again, the only Black individual on that team. When I think about the organization as a whole, I was probably maybe one of 10, maybe even less in leadership. And I remember her saying, yeah, I have been treating you like this. This is, yeah, what you're seeing is reality. And I was like, what? And she's like, well, I felt that I needed to essentially kind of teach me a lesson, kind of put me in my place. And she wasn't sorry about it. And that was devastating, because I remember her being like, oh, I have an open door policy, come and speak to me whenever you want. Here are all these books, talking about leadership and how we can make things better in nursing and how we can change the face of nursing and how blah, blah, blah. It was all nonsense. This treatment that and what she put me through was devastating. I mean, at the time, I kind of was in a really dark place. And what really triggered for me, because I was already struggling, was my mom was sick. And I remember being like, okay, so I was already terrified. I was being gaslit by email. I confronted her in hopes of that, that she did acknowledge that she was this horrible person. But also the fact of the matter was, like, she didn't care. She's like, I'm a director, so you're just a pithy educator. Nothing's going to change. And I remember pretty much getting to the point where I would turn off the lights in my office, and if I heard her coming, I would close the door, lock it, act like I wasn't there. It got to a point where I remember even hiding under my desk, which is really effed up if you think about it, so I would avoid having conversations with this woman. Anyways, fast forward to this day, and my mom was sick. So I heard that she was coming to the emergency department. My husband had sent me a message, and she had always had issues with her heart and AFib. And he's like, oh, she's on her way, so make sure that you kind of meet her. And I'm like, well, I can't. The situation here is really bad. I've already told you that. So, if she's coming here, I'll meet her on her lunch. And I remember emailing this boss that I had and saying to her that, my mom's really sick. She's here. I'm going to go visit her on my lunch. And, just kind of acknowledge that she got this response from me. And I was just like, I knew that was how that was all going to go down. And I remember going down to see my mom on my lunch period and being like, okay, is everything okay? And they were concerned that she might have had a cardiac event. And I was super stressed and already really anxious. And I was like, oh my gosh, I can't, be a minute late getting back upstairs. So I kind of rushed back upstairs to deal with, whatever it was for the day. I remember going back to my office, and she came to my room, and she's like, I need to talk to you about this email. And I was like, what email? And it was like this email between like me, this anesthesiologist. We were trying to kind of institute this whole, pretty much sound the alarm bell for laboring patients. So anesthesia would have a heads up if things were going untoward. And me and this anesthesiologist had many conversations about this. We were all in agreement. And she was like, this is not what was said. This is all wrong. You're really, making issues. You're really messing things up here. And she's like, I need you to fix this. And I remember being like, do you remember that, like, my mom is like out in the ED? And she's like, she pretty much just didn't care. And for me, that was more than enough. I remember she kind of left my office. And it's kind of crazy how, it all feels when you can tell that you're starting to spiral. And couldn't really hear anything. I know she was talking, but it was really foggy. My head felt foggy. And I don't even remember, to be honest, how I got home. And I was like, yeah, stuff's bad. Anyways, fast forward, I ended up taking a mental health leave. I never thought I would, but I was just like, I need to. I think if I step foot back into that place, I don't know what will happen. My mental health was so bad. And it was actually good because what I should say was good was when I first had my first panic attack, I realized that I need help and more support. And I actually started seeing a therapist. So it was good for me to be able to recognize, these signs and symptoms of having situational crisis that was occurring. And I remember pretty much, they didn't give me a hard time to get off work, but they didn't give me an easy time. You think you work in a healthcare institution that people would be a little bit more giving, a little bit more understanding when it comes to mental health. You think that they would be like, okay, we're going to put all the stops out. We're going to make sure that we support you and protect you. And that was definitely not the case. It was just like, it's a problem. It's an issue. Anyway, so I went off on mental health leave. And then I was kind of in this place, kind of in this limbo, trying to figure out what next steps were. And within 2 weeks, they're like, "Oh, when are you coming back to work? When are you coming back to work? We could put a plan in place. When are you coming back to work? When you come to work?" And really, really, so much so from the HR department, they were messaging me every day. That's not stressful when you're already dealing with a mental health crisis. And I just remember being, fine. I'll go back to work because they're like, "Oh, we'll put you on modified. We won't put you back in that department. Everything will be fine. We'll figure it all out, but we just need to get you back to work." So I go back to work and it was the worst decision. Again, employers, HR, they're not your friend. There's no reason that I ever should have felt compelled to go back to work when I definitely was not ready. They should have never been knocking on my door, calling me almost daily, every other day to find out when I would be returning to work. They had all of the paperwork that they needed. Anyways, I went back. I had a return to work plan, which outlined that I was still pretty much in crisis. And again, it's funny. They gave me these forms and my doctor wanted to rip them up because he's like, "What is this?" Everything was about function. How much can you lift? How much can you bend? How much can you twist? How much can you do this and that? And that's not the problem. The problem is in my brain. It's with the chemistry. I need treatment. I need therapy. I need all these different things. But my workplace was like, "We're equipped. Come in. We'll just put you on modified." So went back to work. Worst decision, like I said. And it got down to the point where I was still so much in crisis that I got to a point where I was suicidal at work. They stuck me in the depths of hell in some back office on basement floor or whatever. They left me alone and it was the stupidest thing. And I was fully in crisis. I remember calling my husband, full sweat, panicking, not knowing what to do. At least I was able to call someone because I was pretty much going to end it all here in this office. And I remember he's like, "You need to let someone at work know." So I let this other director know that I was under at the time. And of course I got sent home. It's kind of weird. I got sent home. I should have totally went to the emergency department while I was in crisis. And yeah, they had no safety plan. They rushed me to come back to work with no safety plan. No safety plan. Fast forwarding through because the story is long, but at the end of it, I'm so grateful for the support that I had through psychiatry, psychology, social work, my family support, that I'm here today to be able to continue to tell the story. And it was a story that started the Gritty Nurse because I was like, you know what? How do we have a healthcare system that does not talk about healthcare, does not talk about mental health, particularly of its workers, particularly within the profession of nursing and in medicine and healthcare, where we see these rates of, suicide, mental health, and we just don't talk about it. It's the craziest thing. It makes no sense. But here we are, and we're still talking about it in 2025, where we need to see change. And again, the Gritty Nurse was a great mobilizer for talking about these things because there was nothing out there. Organizations, I'm sure to this date, if I probably knocked on this organization's door, they have nothing in place. But most organizations didn't. Whenever you were to be sent off to work, everything on the work form was about your physical limitations, nothing about mental health. We're still having the same conversations. I'd be interested to know how many organizations have made changes, how many organizations have looked at those functional forms, how many HR departments have stopped harassing patients that are on mental health leave and just, looked at the paperwork and dealt with it that way. And just how many people have taken mental health seriously, that mental health is healthcare. And I would say we're not even there yet. I don't think we've even scratched the surface. I know we have conversations, but we're not even close. I remember saying to her, we should start a podcast. I had a cousin who has a very popular podcast. The podcast is called the Sandy and Nora podcast. And I remember just talking to my cousin Sandy and like, how did you start? Where did you get your beginnings from? And she's like, all you need is a mic in your voice. And that's why I'm here today. I've got my mic, I've got my voice, and we need to talk about mental health and we need to talk about suicide awareness. And I think the other pieces as the reason why the Greedy Nurse was started was to say that you aren't alone. You're never alone. And I think our brains like to tell us that we are, that you're the only person feeling this. There's nothing you could do. This is the decision that you have to make. And it's not. And just knowing that there is more hope and more help that you can get. And when you feel that you don't, or you're hearing those voices from your brain, that's the time to really reach out to receive help and support. And that's what the Greedy Nurse had done for me, at least. And that's why I'm here still having conversations with you today. Thank you for allowing me to share my story with you. Again, it's not easy. It was such an awful time. And I'll be honest, like I hate bringing it up. It's very visceral to me. It's the place where I would not wish my worst enemy to be in, but it's a place where a lot of people have been. A lot of people have been in that darkness. So now we need to be able to talk about it and bring that darkness to the light and hope, not just hope, I should say, and fight for change and fight for better and fight for mental health because it is health at the end of the day. So now let's move on to the next segment, sharing someone else's story and another story in relation to September and talking about suicide awareness, and maybe a story that you haven't even heard yourself in relation to nursing and healthcare. This topic is very heavy, so why don't we take a moment to take a 5-minute break and come back. So I want to move into this next segment where we're talking about stories that have, touched my own heart, and that's stories that definitely need to be advocated about. And this story really tugged on my strings. Again, a trigger warning about the story because the story does include discussing suicide. This is a story that hits kind of close to home. It happened here in Canada and BC. But without further ado, let's watch the clip.
She really enjoyed it because she loves working with people, no matter, what's going on in their life.
Roseanne Wallace, a psychiatric nurse at Kootenay Boundary Regional Hospital for 10 years, took her own life last month at 33.
It was totally preventable. Should never have happened.
Wallace worked in the Daily Pavilion, a unit for people with acute to severe mental illness. In 2021, after an altercation with a patient, Wallace's father says her shoulder was injured and required surgery.
That was the first major one. It was an injury. She was off work because of it.
In February, she suffered a hip injury while handling an aggressive patient. Wallace's family says she was the only nurse on the floor at the time.
Psych units, to me, it's the highest risk area of the hospital, and why isn't that a priority for safety?
The staffing levels have always been inadequate.
The health minister says nurses work in pairs, including in Wallace's unit. Adding Interior Health responded to her first injury by installing a panic button.
It is always my expectation that the health authorities are strictly adhering to the policies that they have in place and that they do everything they can to ensure safe workplaces. We will continue to support them.
Wallace was a passionate youth hockey volunteer. A coaching colleague says her workplace injuries kept her from doing what she loved.
It affected her to be able to play, to be able to work, to be able to walk her dogs. So it definitely did affect her life majorly.
The BC Nurses Union is not commenting, citing the case's sensitive nature.
You don't want to see something like this happen for change to be made, right?
Wallace's family is now calling on others to speak out about potential shortcomings in the healthcare system.
It's fixable, do something about it.
Travis Prasad, Global News.
There are several things in this story that stand out to me that deserve a greater and wider conversation. And I think it's so troubling to hear some of the instances and things that this particular nurse went through before she ended up dying by suicide. And the first part of the conversation here is when she was working on a mental health unit, and there were many times that because of critical understaffing, that she was there alone. Here's my first gritty take in relation to all of this. Why would she ever been left alone to work in a healthcare center, particularly an acute mental health center by herself? It really makes no sense. Everybody checks out at the end of the day. Nurse manager's gone home, the administrators are gone home, the owners have gone home, everyone's gone home. But at the end of the day, like that building, that facility belongs to not just one nurse, but the whole community of healthcare workers there. So whenever it comes down to like a shift or something like that, and it's all of a sudden like only the nurse's responsibility, she or he is the only person there, I find it troubling that it's just like, well, there's nothing we could do about it. There's nothing more that we could do. So yeah, I guess you just have to show up. Because if you don't show up, you've abandoned the patient. And it always gets put back onto the nurse. And I find that very disturbing. Why was she ever put in a situation where she'd have to be in such an acute care area by herself, working by herself? This really should fall back on the employer. Like, I think to myself, I hope that the family finds a lawyer and speaks to them about like, a WCIB claim or an after death claim, because this is ludicrous. Nurses should never be put in these situations where they're left to be working by themselves in a very high crisis, high risk for physical violence situation alone. So right there is one of the first glaring issues that I see. Another glaring issue that I see is the fact of the matter that, she had previous injuries before. And I think back to this whole conversation. I did a quick TikTok about it where we're talking about like violence in nursing in 2025. It's still a thing. We still have to talk about violence in nursing. It's just not been dealt with, and it's insane. Why are we having to continue to work in these situations where we're harmed or we're hurt on the job, and it's like it's supposed to be part of the job? Let me say this to you right now. You can zoom in right on my face. Violence is never a part of the job, and I think we need to start taking this much more serious. If you were working in a grocery store, if you were working in a lab, if you were working in a law office, if you were working at it like anywhere else other than in healthcare, if somebody assaulted you on the job, someone jumped across the desk and punched you in the face, or someone threw you down to the ground and was like, oh, assaults you, or whatever the case may be, you have every right and should have every right to take legal action against that person. That is considered assault. But for whatever reason in nursing, we don't see it as assault. But at the end of the day, it's assault. And I think we need to remove ourselves from saying, okay, well, this patient is ill, this patient is mentally ill, so we shouldn't charge them. We would never say that in any other system whatsoever. So again, I think this is where we have to change the way that we think about when these instances happen. And yes, change the way that we think about it, because at the end of the day, this particular nurse had two injuries. The first injury was so severe to her shoulder that she had to have it operated on. And then the next injury was in her hip, so severe that she was now having issues with activities of daily living. Like, imagine that, right? You go to do a job that you're passionate about and you're injured on the job. I don't know if there's anything related to WSIB or any support that she'd work, but again, WSIB, or if the hospital or organization was held accountable. I think this is where we need to start taking a real critical look as to why we don't press charges, why we continue to go in these situations and work in these situations where we know they're unsafe, and continue to be unsafe and not have those safeguards because our managers, our administrators, our owners of these organizations don't put safety of the nurse as a priority. And I don't want to hear an organization saying that they do, when time and time again we know that they don't. There should never be an instance where a nurse or other healthcare individual is harmed by a patient, and that at the end of the day the result is asking, oh, you do a huddle and you're like, well, what could we have done differently? Well, I mean, maybe not put us in dangerous situations without having adequate staffing, adequate personnel. I think we talked about, what is the role of security or the police? Like, who do you call in these instances? And again, the fact that she's been alone, like, it just begs the question whether this employer is actually safe one. If you were to ask me, based on how everything has presented itself, I would probably say, no, this is not a safe place to be employed. Another aspect of the story that I think we need to talk about is this nurse who had been working in the situation in a mental health facility had to be working with chronic pain. She had mentioned that she felt fear for her life on several occasions. Where is the accountability? Where is the accountability of the hospitals to protect us? Where is the accountability of the public? I think there's this like weird sense in the world where nurses feel like here's a healthcare world, and then like here's the like legal real world, and the two don't mesh because we'll go to our unions, we'll go to these people. It's like the greater solutions have to happen at like provincial or federal levels where we take it outside of our own profession to actually deal with some of the issues. And I think that's something that we're going to have to see time and time again. So look at the instance, for example, Dawn Quinique, who was in the US, who the whole nursing society pretty much kind of almost turned themselves inwards against her and never supported her, didn't show her help. And she had to, of course, move and obfuscate. She had to move away from that system and seek help and support outside of nursing unions to, of course, judicial systems. I think this is something we need to do more. We take that first step where our nursing unions are not supporting us and we get a whiff that there's not going to be support or solidarity. We do need to go to legal jurisdictions, hiring a lawyer outside of, our unions, because if they're not going to help and they're not going to support, then we have to take it that one step further. At the end of the day, we are people. We aren't just nurses. We work as a nurse. A nurse is your title. It's what you do, but it's not who you are. So again, we have to make sure that we look after ourselves and then we hold these leaders accountable. Because at the end of the day, like, what is happening with this organization? I didn't see anything in the end of the story of them being held accountable for this nurse's untimely death. And I think this is where we need to ask some really tough questions. We have to say to ourselves, and we have to think about ourselves as a profession very differently. And, maybe it will take protests. Maybe it will take marches. Maybe it will take working with outside unions and other supports to find a different sense of solidarity, because I'm not too sure we found it yet. Again, another piece that was mentioned was the fact that the hospital said that they did their internal review, but the family felt nothing came of it. And that is problematic. How can we, do these inquests, do these, quality improvements, or we do these case analysis? And at the end of the day, they're like, well, we did the best we can. No, her death was preventable. Absolutely not. You did not do the best that you could. And again, one of the things the father said stays with me. If they ever was to take the time to come down to that unit and have to work a shift by themselves, they would never take a day to walk in our shoes, to walk in that nurse's shoes, to walk in Rosanna's shoes. And again, this is the problem. Our leaders are so far removed from the situation that it's easy for them to say, here's the best solutions, because they're not at the ground level. And that needs to change as well. And the very last piece that I want to talk about, of course, is staffing ratios. This nurse had talked about being critically understaffed time and time again. But here in Ontario, like I had mentioned, the Ontario government has stricken down and has agreed with the Ontario Hospital Associations to say that we don't want nurse to patient ratios. It's going to be inflexible. It's going to be too expensive. It's too rigid. We're taking decision making away from nurses. We've already had things in place for sustainability and to keep nurses at the bedside. But these are all fallacies. If you don't talk to the end user and the end user isn't able to help make those critical decisions about whether they want staffing ratios or not, or the evidence shows time and time again how nurse to patient ratios improve patient satisfaction, improve job satisfaction, improve better outcomes, improve morbidity or mortality, decrease medical errors, and we're going to just say no. That's where, again, that's a huge problem. And the only way we can continue to talk about it is to let patients know and for them to come and continue to advocate for better, because at the end of the day, this nurse should have never worked alone. And I know they would have put it on her if she's like, I'm not going to show up. They would have been like, oh, you're failing your patients. But you know what? They failed her. The system failed her. Nursing failed her. The nursing administrators failed her. if that nurse didn't show up for her shift, they would have been like, oh, she abandoned her patient. And they would have said that she failed, her patient. But you know what I'd like to say? They failed her. They failed that nurse. They failed Roseanne. They failed the fact that she had these injuries and had a change to her quality of life. They failed her that it happened more than once. They failed her that she had to have surgery, feel unsafe at work, show up scared to do something that she should be protected for. If anybody failed her, it was the organization. In this last segment, I really want to talk about something called the vital signs and really kind of us having a pulse on what's happening, because we do need to see change. We can't say that mental health is health without actually doing something about it. Where we're starting to change the conversation in relation to mental health. And the new focus is actually talking about changing the narrative. There are studies that show that more than half of those who die by suicide in Canada have had contact with a primary care provider in months prior, highlighting a crucial role that nurses play. There has also been some more information, some groundbreaking work that's been done by the Mental Health Commission of Canada called Breaking Stigmas and Saving Lives Initiative that highlights that stigma is a major barrier to seeking help and that talking openly about suicide is a sign of strength, not a sign of weakness. I talked about the whole social media piece. Literally, if you put it as a hashtag or you put it in your videos, it is completely downvoted. So we have to think about a clever way to continue to talk about suicide without actually having decreased engagement, particularly on social media. I really like to highlight nurses who are doing great work in the area of mental health and who are actually profiling and highlighting stories that really need to be told. One nurse who is doing this great work is Sarah. Sarah Warren, or Sarita, is a registered nurse, writer, and activist who uses storytelling across social media to help humanize healthcare. She's an executive director and co-founder of the nonprofit Don't Clock Out, a community organization dedicated to supporting healthcare workers through impacts of moral distress. Actually, she has a film which is called Don't Clock Out, and it's a short documentary that she and another producer created. So please, if you can support Sarah, go out and see her film and support other nurses in mental health. Just want to give her a great shout out for doing all this great work. Also, so what I have noticed too is an uptick, various pivotal being more open about talking about mental health, changing that narrative, being more able to talk where they might have been in a place like I had been, and really sharing those details. I think it's important is we need to see more healthcare providers talking about this. There is not nearly enough healthcare providers that are talking openly about mental health. I think there's also this issue, particularly in our profession, not just in nursing, but just in healthcare in general, where we are supposed to be seen as the caretakers, right? We are taking care of everybody else. We've got to have our hats on. We've got to be solid. But at the end of the day, it's okay for us to show that we're not perfect, that we are fallible, that we can make mistakes, and show that human side. Because I think if patients see that, now that might help other people open up and connect. I think vulnerability is a strength. It's not a weakness to be able to share who you are as an individual, to share that story that you might have. Because I think there are other people that might connect and say, hey, that's me too. I was there too. I shared that experience and it was really hard. And I think that it's important that we do shift and change the narrative on talking about suicide and suicide prevention. So I did get a question from someone who asked me, and I'll just read it here. What are some of the signs that someone might see if someone is thinking about suicide? And then also, how might I help a nurse who might be suffering from burnout? And I actually had done my assist training, but many, many years ago. And I think I'm going to refer right to some of the resources that CMHA has put out. So the Canadian Association of Mental Health. And I'm going to just read off some of the things that they listed about knowing the signs and symptoms. If you are concerned that there is a loved one that is suicidal or you feel that might be at risk, I think it's important that you can call 988 yourself, or you can call 911. I think that's the other piece that's really important. I think sometimes we don't know what to do, and the best thing is to involve a professional. But I'll quickly read off some of these signs from the CMHA website. It's really difficult to know if a person's thinking about suicide, but familiarizing yourself with common warning signs may better prepare you to notice if someone is at risk. So people who are at risk for suicide may show a sudden change in mood or behavior, show a sense of helplessness or hopelessness, express the wish to end their life, increase in substance abuse. They might withdraw from people and activities that they previously enjoyed. They may experience changes in sleep patterns, may have decreased appetite. They may give away prized possessions or make preparations for their death. For example, they might create a will. But again, people at higher risk of suicide include those who might have a serious mental health and or addiction problem, have a recent major loss, for example, the death of a loved one or a job loss. They may have a family history of suicide. They may have made previous suicide attempts. They may have a serious physical illness and have impulsive personality. They may lack support from family and friends, or they might have access to weapons, medication, or lethal means of suicide. One of the first things I was taught as a nurse, and particularly in my assist training for someone who might felt that they were at risk, is really actually asking, like coming out and directly asking that question, are you suicidal? Do you have a plan? And do you have means? And those are some of the questions that we asked. And again, I think as just maybe a friend or someone, that those might feel like tough and challenging questions, but I think they're important questions to ask. And I think at the end of the day, the best thing to do is to consult a trained professional. So like whoever their most responsible person is from in terms of whether it's their social worker or a psychologist, psychiatrist. But at the end of the day, if someone is feeling suicidal, the best resource is to call 911 or 988. So, for example, I have had instances where I've had to talk to someone who was suicidal, and it was very scary. I'm not going to lie. And one of the things is that I did was listen to them and really take them seriously. I didn't judge or minimize their feelings. I tried to be very positive and hopeful, and remember and reminded them that suicide is something that can be prevented. It's always important that you ask them if they have thoughts of suicide, if they have a plan. Ask them to rate their suicidal feelings on a scale of 1 to 10. Let them know that help is available. Encourage them to talk about how they're feeling. Encourage them to seek help from a doctor or a mental health provider. And then also you can make a safety plan with them. Avoid leaving this person alone if they're in crisis. I think you as an individual, if you're dealing with this, it's also important to seek help yourself too. No one has to carry this burden alone. I think that as a community, this is the way that we build support, and we should try to form a community and make sure that we strengthen not just ourselves, but the people around us. So lastly, I really want to say thank you for tuning into this kind of special edition episode of the Gritty Nurse podcast. It's always so important to have these conversations about mental health, even if it feels challenging. It's crazy, we care for everyone else, but we just don't care for ourselves. And I believe that the more we have these conversations as healthcare providers, the better that we are at helping patients recognize the symptoms in themselves and feeling safe to come forward to talk about the situations that they might be dealing with themselves. The fact of the case of Roseanne, who died by suicide in BC just this April, and that there's a whole heap of system issues related to how her death could have been preventable. And then really talking about violence in nursing. We aren't punching bags, and we should not be punching bags. How do we create a workplace environment in which we are feeling protected? And at the end of the day, just really, it's a call to action. As we end and close this episode, I want to leave you with a number that you should remember. And that number is 988. It's not just a number for those in crisis. It's a 24/7 free confidential resource to anyone. If you are a nurse or healthcare provider and you're feeling the weight of the profession, if you're concerned about a colleague, if you're just feeling overwhelmed, please know that you can call or text 988. This lifeline is here for us too. So let's make 988 well known. As known as 911, and change the narrative from a silent code to a life-saving call. So again, thank you for tuning into this episode of the Gritty Nurse podcast. I'm your host, the Gritty Nurse, Amie Archibald-Varley, and I'll be here every Thursday, maybe. I don't know. We'll see. I'll be here on Thursdays sharing episodes about health at the intersection of health and health policy, and advocating for change within nursing and within the healthcare profession. Stay tuned, and I'll see you next week. Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much, and stay tuned until next time. Stay gritty.